This is the Cardiopulmonary Resuscitation for Infants Skills video for the UCLA Center for Prehospital Care. First, I will ensure I'm wearing body substance isolation, which includes gloves and eye protection. When responding to a patient suffering from a potential cardiac arrest, start by checking responsiveness by flicking the baby's feet and shouting. Baby, wake up, wake up. Patient's unresponsive, call ALS, get an AED, airway bag, and come back.
Copy that.
Check the brachial pulse on the same side as you. You should assess it on the inside of the upper arm, midway between the infant's elbow and shoulder. Attempt to palpate the pulse for at least 5, but no more than 10 seconds.
1006, 1007, 1008, 1009, 1010. No pulse, no breathing.
If there is no pulse, or you don't think you feel a pulse and no breathing, initiate chest compressions. Expose your patient's chest by moving the clothing. Start CPR with cycles of 30 compressions and 2 breaths. Use an AED as soon as it's available. For infants, single rescuers can use either the 2-finger or 2-thumb encircling technique. Place the infant on a firm, flat surface. Place 2 fingers in the center of the infant's chest just below the nipple line. Give compressions at a rate of 100 to 120 beats per minute. At the end of each compression, make sure you allow the chest to completely recoil. Place both thumbs side by side in the center of the infant's chest, on the lower half of the breastbone. Your thumbs may overlap on very small infants. With the fingers of both hands, encircle the infant's chest and support the infant's back. With your hands encircling the chest, use both thumbs to depress the breastbone at a rate of 100 to 120 beats per minute. After 30 compressions, open the airway with a head tilt chin lift and give 2 breaths, each over 1 second. Remember to only deliver enough air to see the chest start to rise. The 2-thumb encircling hand technique is the preferred technique when 2 rescuers provide CPR. After 15 compressions, pause for the second rescuer to open the airway with a head tilt chin lift and give 2 breaths, each over 1 second. The chest should rise with each breath. Minimize interruptions and compressions to less than 10 seconds. Continue compressions and breaths at a ratio of 15 compressions to 2 breaths. Press the on button. We can attach the AED pads while doing compressions to minimize the time off the chest.
Plug in pads connector next to flashing light.
Once pads are placed, plug into the AED. The rescuer providing chest compression should switch roles with another provider every 10 cycles or 2 minutes to avoid fatigue and maintain high-quality chest compressions.
Touch the patient. Deliver shock now.
Clear.
Press the orange
Shocking.
button now. Shock delivered.
When delivering ventilations, squeeze the bag only until you see chest rise. Each ventilation should be delivered over about 1 second. If the victim is breathing normally and a pulse is felt, activate the emergency response system if not already done. Monitor the victim until emergency responders arrive. Remember, the primary cause of cardiac arrest in infants is respiratory related. If you are caring for an infant who is not breathing but has a pulse greater than 60, you will perform rescue breathing. This means you will deliver 1 ventilation every 3 seconds to the infant and assess the pulse at least every 2 minutes. It is important to count these ventilations, as hyperventilating your patient is detrimental to their health.